Morning, people. Just going to jump on here and try and discuss what the difference between physiotherapy, osteopathy, chiropractic. It's a topic that's been talked about quite a bit. First and foremost, all three professions through the same kind of rigorous training, 3-4 years. My biggest bugbear with osteopathy and the profession is basically the professional body. I'm in this job 24 years and still patients think, oh, I just thought you did back and necks, didn't think you did knees and all the rest of it. We do everything, yeah? You know, and it's not just joints. You know, we look at the body as a whole. When I look at somebody, I think, right, what is the problem here? I do a lot of sports stuff, so I see a lot of soft tissue injuries that are purely soft tissue injuries, not related to any bony stuff, yeah? When it comes to spinal stuff, yes, you look at the spinal mechanics, but also the muscles around it, because the muscle attached to someone. Muscles got to attach to bone, yeah? Physically, that's how we are made up. So when somebody says to me, oh, it's just muscular when it comes to spinal stuff, no. Because the mechanics will be altered if the muscle goes into a spasm, or if the joint gets stuck, the muscles will contract and tighten. So you treat both at the same time. This is where I think the chiropractors get it wrong, personally. I think they just manipulate and don't do any soft tissue work. So if the muscles contracted tight, okay, you release the joint, you feel good for a bit, but the muscles still pulling will cause a restriction again, and vice versa. So that's the first difference, I think, personally, between a chiropractor and an osteopath. You'll spend half an hour with us at least. A good 20 minutes to be on soft tissue or more, and the adjustments take seconds. Whereas the chiro, you're in there 10 minutes and you're out. They want to see you like 2 or 3 times a week. On average, we see you once a week. If you're acute, maybe twice a week. So that's the first thing. Second thing, what I'm seeing with physiotherapy now, especially NHS, is it's very hands-off treatment. Again, this is my personal viewpoint, but this is from patients telling me they go to the physio with the doctors. They're listening to their case history, give them a list of exercises to do, go home and do those. Very little hands-on treatment. To me, treatment is getting your hands dirty. Treatment is actually treating the patient physically. Rehabilitation exercises, well, Dr. Google can give you those yourself. So, you know, a combination of both is what you want. So obviously you come to see somebody, they treat you, they give you advice, they give you some exercises. In the clinic we've got a great program called Physiotherapy, which send patients exercises and videos so they can't go wrong. So there's 2 things so far. What else? Yeah, I don't know what else really. Yeah, obviously then the basics. The other thing is osteopathy, like chiro, we learn to manipulate from day one. We're trained that way. Physiotherapy undergraduate level doesn't learn to do the manipulations. Rightly or wrongly, I don't know. But basically, again, coming back to spinal stuff, you need to be able to do grade 5 manipulations, which is what the physios call grade 5. We call high velocity thrust. You know, you will get to people coming in with a joint restriction. And no amount of soft tissue work and stretching will get that joint to move again. If you want quickest results, which is paying less money, you want to get that joint released if it is stuck. Yeah. So that's another difference. It's very difficult because we all cross over a link. I know some very good physiotherapists out there, excellent. I know some bad ones. I know some very good chiropractors. I know some bad ones. I know some very good osteopaths and bad ones. So it's like any profession, you get good and the bad. But as a generic, I also think coming out of college at the moment in osteopathy, there's so much worry about litigation and stuff like this. I mean, if I couldn't do my job the way I want my job, I wouldn't do it. I look at somebody and say, I think, how can I help this person get better? And I try my best to do what I can. You know, so, and, you know, the best thing of me is I talk a lot, so I try to explain to people what's wrong, what I can do, and go from there. So I hope this video helps a bit. I know it's difficult because it's not a crossover, but basically get your hands dirty. See you guys.